today's faculty and academic staff forum here at the University of Wisconsin-Eau Claire. My name is Erica Benson. I'm the Executive Director of the Office of Research and Sponsored Programs. And today we have a special panel for you on interdisciplinary collaborative research. So I'd like you to join me in welcoming our experts today who will share their experiences, take your questions, and also give advice engaging in interdisciplinary collaborative research. I'm going to allow our panelists to introduce themselves first, so let's give them a warm welcome, and then so I've mentioned to the panelists that I have a couple of questions prepared, but they are ready for your questions as well, and to hear what you would like to know more about. But I'm going to begin by asking you to introduce yourselves and to tell us about your experiences with interdisciplinary projects. So Marquell, would you start?
Yeah, Marquell Johnson. This is my 18th year at UWEC. And in my experiences, I guess the ones that I will focus on here are just I've done last 4 or 5 years UWEC Claire Mayo collaborative projects with Mayo's Family Medicine Institute out of the Eau Claire branch, but also the Casson Rural Health Purpose branch, working with family medicine residents. And then in my earlier years, had opportunity to work with speech hearing language sciences, which was formerly communication and sciences disorders, with their aphasia camp, incorporating some of what we do from a physical activity standpoint, quality of life with a lot of aphasia camps. Thank you.
Hi everyone, my name is Melissa Emerson and I teach business law classes in the College of Business. This is my 5th year here at UWEC Claire. I have a JD, obviously, and a PhD in public policy and public administration. Both of which are very interdisciplinary by nature, so my research has primarily focused on access to civil justice, volunteer and public service motivation in the nonprofit and public sectors, and most recently sustainability and human rights issues, particularly the role of business in that discussion.
I'm Sortedahl, and I'm from Emerson, and the most recent interdisciplinary collaboration is with packaging. Nurses use a wide range of packaging, and a lot of packaging. They're sterilized contents in the care setting under a variety of environmental conditions, and so that's of interest to me. Some of my background in solid organ transplant and emergency department, which sort of informs, the questions that you have, and projects and things that I'm interested in. That's been part of the things that I've been interested in, and I was very fortunate to document some from the Stout. She's the packaging program director there. So we started a new collaboration, working together with packaging students and nursing students to have a common goal, so care using packaging. And we formed a team with students from packaging and students from nursing, and packaging students created some kits for the nursing students to use. Students created some educational modules, including a video demonstration of using sterilized materials with a medic. So that's what we're currently working on. It's very exciting, very exciting.
Last but not least, I am Stacey Jackson, and I'm an associate professor in psychology and also a counselor in counseling services. Probably the more recent, I think, collaborative research that I've done has also been with Mayo, working with a number of different people, but one of them being one of the publications in athletics and doing a lot as it pertains to student athlete mental health. And so that's been some of the more recent 2 or 3 different projects that we've done with athletics. And then very, very recent, I've been doing a lot of education and training with the Eau Claire Area School District, with teachers in the school district, and working very closely with Jay Yang, who's the director of equity, diversity, and inclusion in the school district. And we've started and some of the supports that we've been providing for educators in the school district, we've now started to collect some more data, and do some research projects alongside of the work that we.
So the next question I wanted to ask, has to do with how you navigate the differences in search methods, disciplinary approaches, even terminology, between disciplines.
But I tend to try to collaborate with people that utilize the same methodologies that I do to make it not difficult or challenging, I guess, on my end, which is there's pros and cons to that, obviously. But you know, with even thinking about terminology and even understanding like a lived experience, I was a former student athlete. I played D1 soccer and ran track, and so in the student athlete mental health has been a personal interest and experience of mine, and also, you know, a research interest as well. And so working with athletic staff, with some of the physicians and the coaches and athletic director, and just having conversations about their schedule or preseason physicals that they have to do, just some of like all of that conversation is not new to me. And then, you know, having discussions about what research would look like or could look like, and what would be sort of a preferred format for athletes to be able to engage in is what I was used to as an athlete, and is the type of research that I already do. So it was fairly easy and has been fairly seamless to do the research, because it's essentially what I do. And then also, last piece of that is being sort of the faculty part of the partnership between the physician at Mayo and myself. She definitely heavily relied on for a lot of the making decisions on like that. So
When I was thinking about this question or the different terminology, and so there's different models for interprofessional partnerships, and one of the things that we thought about was choosing model, a guiding model, just a framework. This is the framework for action on professional education collaborative practice. And that was helpful, I think, for when we were collaborating in a team for the faculty and the students. And we do have different terminology in preparing certain disciplines for course. And so we did learn there's different terminology, which was kind of fun to learn. So we learned new terminology that packaging had, and they learned terminology that Emerson had, and I think that was really formative, kind of when they go into the workforce, they are going to be working together, and certainly packaging engineers to look at usability of their designs, and so it's really helpful. There's terminology, and I think different disciplines or different approaches in methodology, I think projects stronger because there's some similarities. So I think differences can be helpful, and I think it just takes time to learn the new terminology.
And building off that, just with the terminology, just making sure that everyone is on the same page. It's really important. I started working on a project with a colleague who comes from a very different field from mine, involving sustainability, and we spent about a month trying to hammer out a definition of sustainability, a working definition for the purposes of our project. You do have to kind of look at where your published work is headed, where you're going to present. We all know research is messy. There's a lot of the institutional theory, for example, was like a really small component of my dissertation, and I remember somebody from political science, I think it was international relations focused, they use institution theory way different than the way that I was using it. So you're just gonna encounter that, and you just have to be really clear about where you're going. Everyone is on the same.
Building off what the other speakers have said, for me, it's having that agreement of the research question, coming to that agreement, but more importantly, it's how the outcomes from that research align with all of our professional expertise. Are we able to use some of the work? I take a back seat to individuals if these outcomes you're going to utilize towards your potential expertise. I'll jump in and assist with writing an abstract for me, it's kind of interesting where I think the interdisciplinary approaches really come. It's a forced consistency of actually communication that has, and not just by email, because some things get lost in translation. There's this continuous communication that has to take place, and and the cool thing, it take place via a virtual meeting, adult beverage during the evening, as you're sitting on the couch and you go back and forth in that communication, but it forces something beyond actually the email exchange, and that's really the added.
I have more questions, but I want to allow, audience to ask it.
Can I ask one?
Absolutely.
Sorry. Question. Were there instances where you had to take into account professional priority to make? So, for example, you're interested in collaborator has no interest in that, or worried about it, or worried about patient health. How did you connect?
So, appreciate that, Mike. So, I think the interesting thing, those of us who have had an opportunity to have, I encourage, there's opportunity, especially like funding, but there's opportunity to learn a different perspective. So, those of you who work with kind of like Mayo and the triangle, the focuses, it's interesting for family medicine physicians. They don't necessarily have an interest on like a publication. It's either patient outcome and or actually in our case, family medicine residency training, education and awareness. And what that looks like is actually different than me putting together an abstract and having us go present at a professional conference now, submitting a paper. I think in all of those, it's really the communication of trying to figure out how do we look at this data and what are we telling these up and coming family resident physicians? How do you be more aware about how your own personal health and what we're looking at sleep behavior, depression, anxiety, and the overall physical activity, how that impacts your ability to be a more intentional practitioner. And it really forces us to look at the data in your mood impacts interactions. Your level of activity and alertness impacts your work productivity. And we have those discussions. And for me, I'm not really sure every time I look at the resident sleeping patterns and the resident schedule, it is pretty amazing actually that they are able to engage actually on an everyday basis actually with patients in clinic. I think it's a lot to get a curriculum for family medicine. I assume that's how it's been forward in the training pieces. And so it was a back and forth. And the last thing that we did in our projects, we provide all the raw data and clinical reports to these family medicine residents and allow them an opportunity to follow us for further interpretation. And really, one of the interesting things that came out is when they're doing their night shifts, for instance, poor sleep quality, disrupted sleep, but also not meeting the required 7 to 8 hours for adults. And so what are ways that potentially in your day you can adequately actually that piece of we have a focus and it's beneficial to actually like the clinician, but to have a presentation, but that's not really they're wanting how do we actually be informed of actually creating better actually physicians. And it's really been a great back and forth.
I would add to that too. I know for the most recent project, active mental health, we were exploring a recommendation that the NCAA suggested regarding. So it's more of an exploratory study, and the various athletic trainers and physicians wanted to implement more. Honestly, it's sounding more of like a program evaluation type of a study. Where to what Dr. Johnson said, question you know, purposes myself, and we had, a McNair student and another student who are part of it too, and so for them, they're wanting to disseminate, you know, results of a research study, and so it's like, how can we do both? And so one of the things that we did make sure to do was prior to the study and even following the study, we provided the results to the coaches, athletic director, and the trainers and staff, and gave them some recommendations on what to do based off of the findings of our study, so that we were able to meet the needs that they had regarding things that they wanted to address the needs and the concerns that the youth athletes had prior to us, you know, conducting our study, and also to conduct a study such that we could disseminate, you know, results of the conference and everything. So, similar, you know, engaging in that conversation, finding.
Yeah, I think most of my projects have been designed with that in mind, kind of at the beginning stage. And it can help with a lot of things that you wouldn't expect. My dissertation collected data from 10 Mississippi cities, and all the workers in public service in those cities. And we had a 79% response rate because we had buy-in from the mayor or city manager, and then, you know, part of the promise was, hey, we're going to share these results with you, and we also had to maintain confidentiality, but some of the cities were smaller than others. So it's kind of walking a tightrope, but you're also delivering, it's a win-win situation. Come across this data anyways, you just build in giving that report out. And just recently applied for ORSP funding with the community partnership project with textile upcycling, and part of the piece of that is delivering results to our business partner, but then also helping UWEC students with the research process and getting them some deliverable through circa presentations or journal, and then, you know, continuing this piece out and hopefully developing some information or journal publication for myself. So kind of hit all the nails on the head, and it's mutually beneficial and very rewarding.
Well, and adding on to that, I think just working in teams or collaborating, it goes back to just hearing everybody talk. It reminds me, you know, what your goals are and whatever the goal is and what you're trying to accomplish. Collaborations, they all sound very large, right? And so you have to talk about what our goals are, and they have this role, it's this role, but hearing what everyone's doing, it let us see what the results are. And so sure, sleep issues for residents is occurring all through states, and that's all the student athletes is occurring all the United States. So if you're doing great things in public policy, I'm sure there's other people. So that is an important part of what we found out there.
I'm curious about the process by which these partnerships came to be. Was it just a series of happy accidents, or did you intentionally looking for someone outside your discipline, or how did these happen?
Just briefly repeat that just for our online viewers. So we have a question about the process of how these collaborations came about.
I think for there were certain groups, I think, in the beginning that we collaborative initiative first sprung out that were identified. The other interesting piece is, as part of that initial piece, you were given. I've found it pretty interesting working with physicians, because physicians have like remarkable ideas, and I think another panelist basically said that you take the role of actually designing some of these things, and so you for myself and the collaborators is you're listening to a lot of the ideas that certain physicians have, and then when you realize that you're probably more responsible for not only the methodology but the execution for data collection, that dictates who you're willing to actually work with. And right now with the current setup is I look for collaborative individuals in Mayo that allow my students to be more involved. And unfortunately, the way the system is set up right now, students can't technically get into Mayo and work with actual patients. There's this whole other thing. So what can we do outside of those particular confines to allow undergraduate student interaction? Because I could not do any research without actually undergraduate students. So, but attending some of those initial UW Eau Claire Mayo collaborative initiatives, but also we were provided at one point a list of, kind of physicians who had also let Tim Nelson know that they were interested in engaging in research and provided general topics. And so I think with professional nudges from Provost Carney and others that, you just kind of take a look at the list and you begin that process of actually reaching out and you hope for some takers, but we have been fortunate enough, and some of my other colleagues in the department have really been fortunate enough to really get some connections with me.
I think there's a little happy accident things happening too, but most of mine have been through just communicating with people. I ask a lot of questions. I'm curious about what other people are working on, and I think that's the road in for most of what I've wound up doing. Like the most recent community-based partnership, I met an entrepreneur at an event where I was a panelist and was really curious about what she was up to, and one of us suggested, let's have coffee. Then we discussed, and then it just kind of rolled into World Forward. She had applied for the community-based research here through the university and was awarded it. And so that's how that happened. So, curiosity and networking, I guess.
I think that's a great way to say it, curiosity and networking. The project that we're working on was curiosity that I had based from practice and looking at reducing waste and can we educate nurses better so they're better prepared for the workforce. And it was meeting someone who had similar interests that after we discussed it some more, then involved into this more formal partnership. So it can be a little bit of both.
Yeah, I'll just add, I appreciate the question. I'm the least seasoned person up here, I think. And so I know my first Mayo collaborative was by virtue of a physician reaching out to the chair of our department, inquiring about faculty that do research with mental health. At the time, there were 3 of us with the clinical background, and one was heavily bought out by grants for research. The other one was on her way out to retire, so it left me. But also there was the shared interest, so that was helpful. And then I've also even more recently now, as a result of doing a few Mayo projects, have had interest in working with other physicians in other areas, but also collaborating with faculty across campus, which I found to actually be challenging, and probably more challenging than the Mayo Collaborative. I think just the way that it's designed, it's easier, I feel like, to create the partnerships and get projects going. I think across campus, I found that to actually be more challenging. For a number of different reasons, which I can get into later. But I think some of it does really require a lot of kind of groundwork on your end to try to seek out the partnerships and relationships and get those collaborations started.
I would like to follow up on a point that you raised there, Stacey, is challenges. What are some of the challenges that you've encountered in either prospective interdisciplinary collaborations or existing?
I can go first since I mentioned
Thank
it. There's a lot I can say, but I think across the board, just timing and schedules and an ability to be able to meet. In working with physicians, I mean, their schedules are outrageous. Our schedules are, outrageous. It's hard to find a time to meet, even if it's just 2 of you. When you tack on students, when you tack on data analysts, or all of these other like specialists and experts and things like that, it just makes it very, very hard to find a reasonable time during the day or even early evening or early morning to meet, and Zoom and Teams and things like that are helpful. But it's hard to finalize things when portions of the team are there, not everybody's there. Things get lost in translation and email, and so it's helpful to be able to speak verbally, even if it's, virtually. And so that I think was a fairly big challenge. I think sometimes when there's changing in members of the team, there was some changes in some of the team that I worked with at different times in our project, and so new people were brought on, but then they had to, get caught up on what the project was, and so that kind of added time to really being able to complete things. And so no fault to what contributed to the change, but it just added to the time, which made it challenging.
Yeah, I would say the same thing, is that time is the biggest issue probably in a lot of areas, right? In many areas in life. And I think having scheduled meetings is important too, but also other things come up. So you have to have a plan, but you also have to be able to adapt and be flexible and build in some time in addition to that. And I think everyone's trying to be as efficient as they can with their time, but I think it usually has taken me more time than I ever anticipated. And having good collaborators who can meet when possible and also have some flexibility, I think helps with some of the challenges. So.
I don't have a lot to add. I would agree with all of that. It's nice to have like an in-person meeting at some point as well, which can be important if you go to the same conference. Scheduling just a small dinner with your group, your team, can be helpful as well.
Yeah, I guess to avoid, everything has been said, but everyone hasn't said it, so I won't say it, so, yeah, we're good.
You talked about the importance of dissemination, and I've heard Marquell talk about, that your focus on, or need to publish, for instance, is important, and sometimes you've taken the lead on a lot of that stuff. How have you negotiated authorship for various presentations, journal articles?
Yeah, so, that was one of my challenges that I have written down, and, I have, so I have a rule, and, I think in my 18 years on this campus, reputation actually precedes you, that I'm a pretty direct person. And so for me, all of that has to be communicated in the beginning, and where I stand, and that's interesting with certain collaborators, interdisciplinary. If you made no attempt to actually write anything, you potentially can have a co-authorship if you were helping us actually get participants, but first authorship, right? It's a non-starter. And certain individuals, I actually do not actually think they think we're all a team and it's very collaborative, but it's collaborative on certain levels. And so it's one of the things, who takes the lead in writing up and doing the primary data analysis. That's kind of how we do authorship, with the exception of Circa, and with the exception of some of our undergraduate students. So we also have another rule in our department. It's kind of unspoken rule, but if we have like seniors who have worked on a project with us, we'll allow one of them to actually be first author on a professional presentation at a national conference, because potentially we've had a lot of students previously who've had faculty who have graduate programs from other institutions come and stop by their poster and offer them graduate assistantships on the spot, right? And so, but the publication pieces, yeah. So it's kind of we really, and and to their credit, I'm not saying actually like male physicians are actually not good writers. It's been my experience, none of them actually engage in the writing process. Mm-hmm. They do have some feedback to give you as it relates to potentially data analysis. But like in the writing process, it's a matter of time, because they're shifted different places. And so that's that piece. And so I communicate that at the very beginning, but it's an ongoing process, because some individuals, it's unspoken. there is some expectations as you utilize the data and you have opportunities for multiple publications, multiple presentation. There's this idea of actually this professional rotation that would take place, and that does not actually exist with Marquell, but it may exist with like others. So it's who's doing the majority of actually that initiation piece. That's kind of how it's worked for me in the past. So.
Yeah, I think fairness is important. Just having learned the hard way, you have to spell out who has control of the data set and who gets to share it and what the parameters are there. Now, as an attorney as well, I just have an agreement in place at the beginning. Just having had a really bad experience sitting in a conference and seeing my data set presented and my name wasn't even mentioned. And the presenter, in all fairness, didn't know. It was someone else who had access to the data set. So you learn the hard way, and then you just bring out the legal guns and have an agreement in place.
I think the dissemination part is important. And also I think when you're collaborating, that opens up more areas where you can get the information out because you're dealing with more disciplines. So it opens up other fields and multiple areas where the information could get out. So, and should get out. But I think it is more successful when you have those agreements in place, either in writing, verbally, or however you do that.
Right.
But in writing, yeah, writing is the best. Yeah. That would be your expert opinion, right? Yeah. So, so I think that is important. And sometimes we're so excited to get started that, maybe in the middle of a project, we think about that, but it's important to do that early on and in writing, it sounds like.
Yeah, I just reiterate, for me, it really equates to like the amount of work one has put in. And if students, you know, especially if they're seniors or thinking of grad school and everything else, and that's important to them, well, you're gonna have to put in the work to get that. So, and a lot of times they do, and I usually will kind of be just the final eyes looking things over and giving feedback, but.
As we're wrapping up, I think that question that you asked at the end, my utopian idea of actually higher education has kind of been kind of completely kind of erased in my 18 years. I think it's somewhere, you know, I always thought that I would be in this center of actually constant critical thinking, questioning and answering, going back and forth with colleagues, undergraduate students, even the community would actually view us as this immersed place. But when I think about this idea, and you think about where we're going as an institution, and maybe this already exists on our particular campus, but I was thinking about like, you know, would it be cool? So you see like in the entrepreneurship, they have like these incubator spaces, right? And so, you know, this having kind of like this interdisciplinary collaborative like incubator space on campus where, you know, you're going back and forth with colleagues that have ideas and are, as we move in this direction of the utilization of actually artificial intelligence, all of us put our various research ideas and our topics at a campus or a college level, and we let AI actually make these generated actually mix of good fits, right? And it spits back out like you would be a good fit based on your research with these individuals here. And so I think it was Dr. Jackson that mentioned earlier some of the challenges of actually doing interdisciplinary work amongst our colleagues, different departments, different campuses like that. And that's really because I think where we're going to, and whether it's federal funding or any type of funding, I think it's that being able to, that research expands just one area and it benefits multiple individuals. I think that's probably where I think most funding opportunities will find themselves. But for me, it's just the idea of one of the last utopian ideas that I think campuses, there's still a critical mass of actually critical thinkers who want to actually ask questions, who want to go back and forth, and between all of that communication, very good ideas that can impact a greater group is still possible. And so I really, that was that question for me at the end, that was really kind of, what can we do to really kind of promote that? So thank you.
So if anyone else wants to chime in on what can we do as a university to help support and foster these interdisciplinary collaborations. So an incubator space, one idea.
I think bridging that academic practice partnership is important too, however we can support that. So whatever the discipline is or the industry is, if it's healthcare or engineering or whatever industry we want to talk about, I think is important because I think that can inform how we're preparing students, and also if there's a question, maybe the university can provide some expertise to help answer that question and guide that question. I mean, I had a lot of questions at 2:00 in the morning as a emergency department nurse, but I had no way to get those questions answered, right? And so I think there's a lot of benefit to having those partnerships, not only just collaborating with each other, but collaborating with industry, academia, and practice. So however we can encourage that, I think makes it better for everybody.
I'm sure it probably wouldn't be ideal for some, but I think that, however you want to view it, I think that there is some value in not necessarily having it as a requirement, but there being some sort of a benefit to, like, when you're going up for promotion and tenure or various things like that, that it is something that you can kind of explicitly sort of check, like, I engaged in collaborative research to some degree. I think that that might be an additional incentive for some to engage in that type of work, whether it's across campus, whether it's in the community or the Mayo collaborative that we have. It may encourage individuals to engage in that if there was some sort of an additional sort of incentive other than just, at least for faculty, how we add that into scholarship. And maybe it's like a stipend, maybe there is some, I don't want to say reduction in load, but I know that the timing can be difficult. And one of the challenges I found with trying to collaborate across campus, and quite frankly with Mayo as well, but across campus especially, is that, various faculty have ongoing projects that they're engaging in, and to start up something new while they're also trying to wrap some other things up is difficult to do. And so I something to that degree might free up some time, or, force time to be created, I guess, to engage in that collaborative work such that box is checked essentially.
I agree with everything the other panelists said. I like the AI idea. That's kind of cool. I mean, all of our CVs and everything are available, so like the data's out there. So cool idea.
Is there a dream collaboration any of you have? Like with an individual or a group or a topic or anything?
I wouldn't say a dream like specific people, but in the clinical work that I did in graduate school, I did a lot of clinical work in residential treatment facilities or in-state hospitals for people with more severe complex mental illness. And we always had like a treatment team, and there'd be, psychiatrists, psychologists, social workers, teachers, legal personnel, whatever the case may be. So there was a bunch of different representatives who all worked with it was kids, children and adolescents that I worked with, who all had some sort of involvement with them, and we would all have, these treatment team meetings, and we would all talk about those interactions, and then we would all pool all of that information to kind of determine the plan. And so when I think of just, the role that I have as, a person in psychology and with a clinical background, I think about that like treatment team sort of mentality. And I think about, mental health and all of these different ways in which it plays, and all these different factors that influence mental health. And so kind of thinking about like a treatment team sort of approach, but like for collaborative research, like getting, the perspective of people in healthcare, people in the law field, teachers, all of these, like education, all of these different areas kind of serving as like a team and conducting research that way to understand a problem from all of those different perspectives. So that's what I guess kind of be the dream collaboration, so to speak.
Yeah, that's a very good question. I think for me, I had my start in an adaptive physical activity, working with wheelchair athletes, Paralympic athletes. And so I think I have on my bingo board, to hopefully cross off at some point in time to work with US Paralympics. And my undergraduate mentor actually just received an assistant directorship under United States Paralympics. So that would actually be my hope to potentially do a Paralympic collaboration. So
Mine would probably be Legal Services Corporation, just to work on, go back to where I started with access to justice and be really cool.
I'm really excited about what we're doing now. It's really fantastic. And I think just making it bigger and maybe adding some other disciplines, legal aspects aren't everything as well too. So I think just making it bigger and adding more would be helpful.
Let's thank our experts for sharing their experiences with us. And hope that maybe this will spark some ideas for collaboration for others. So thank you.
Thank you.